passionate, outspoken, insightful. Ariva Martin is an award-winning civil rights attorney, best-selling author, legal commentator, and America's advocate. Live from Los Angeles, this is The Special Report.
Good morning and welcome to our viewers in the U.S. and around the world. To kick off this morning's broadcast, do me a favor and please share the show with your online friends or start a viewing party. And remember, post a comment or question. Your voice matters and I want to hear from you. The last 3 months of the school year were done through Zoom calls and Google Classrooms. Students from kindergarten to college had to make it work from home. Many parents were pulling their hair out and wondering, when is this homeschooling going to end? I was one of those parents. Now the debate is when, if, and how to reopen schools. You'll be surprised to learn that a recent poll has the country split on this decision. 40% say they'll keep their kids at home until it is safe for them to go out, while 60% of parents say they want their kids back in school and they want it done ASAP. Fueling the fire to reopen sooner than later is none other than Donald Trump. Let's listen to what he had to say at his recent Tulsa, Oklahoma rally.
When you see a little kid running around saying, boy, oh boy, do you have a great immune system. How about a piece of your immune system? They don't even know about this. Let's open the schools, please. Open.
Now, that was almost a week ago, and you hear those crowds chanting and clapping and cheering as Trump says, let's open the schools, please. That was before 36 states around the country were seeing surges of their coronavirus cases, including surges in younger people that are widening the percentage of coronavirus hospitalizations. And guess what? Some states are even blaming younger people for the surges. Governors like Florida and governors in Texas are saying that these young people who are going out to bars, going to restaurants, and to beaches are spreading the virus to older Americans. Today, 2.6 million people in the US have been infected, and sadly, more than 127,000 people have died from the virus. 40 people a day are infected in the US, and Dr. Fauci, the nation's top infectious disease doctor, warned that 40,000 could easily grow to 100,000 people a day being infected by the virus. Now, it's against this backdrop, these growing numbers of cases, the president saying get kids back to school, parents split on whether kids should go back or not. This is the backdrop that educators across the country are grappling with this decision about whether to start school in 2021, the school year that for many of us would literally be starting next month. August, September is when kids typically go back to school. And there are 56 million kids in K through 12, 130,000 schools that are going to have to make this critical decision. And even though Trump and governors are saying, get these kids back to school, some educators and some parents are saying, not so fast. Let's discuss. My first guest is Lily Escalson Garcia. She leads the largest union in the United States, and she represents 3 million teachers and other educators. She is the president of the National Education Association. Thank you, Lily, for joining me this morning. Had to make sure I don't call you Miss Garcia, but thanks so much for joining me, Lily. Wow, this is like a super huge decision that has to be made, and it has to be made pretty quickly because literally kids go back to school in August and September. What are you thinking as the head of this union, over 3 million employees that look to you for guidance? Like, what's your gut reaction about our kids going back to school?
So first, thank you for doing this story, because people keep asking me the wrong question. They keep going, when? Do it now, or then. Dr. Fauci's of the world will say, looking at testing and tracing and infections going up or down, we will tell you, and I will listen to the experts, not to a politician, not to Donald Trump, about when we can start opening those doors. But there is no infectious disease expert who says you're going to open those doors and it's going to look just like it did when the kids ran out the door. When we left those schools, it was like somebody pulled the fire alarm in hundreds of thousands of schools. You know that. It was like, grab what's on your desk. And we didn't know that we wouldn't be coming back for months and months and months. We didn't know that in 24 hours, we have to turn ourselves into virtual teachers and all of the inequities that went along with pandemic parenting. But here's the thing, we can do it right going back in. And there are people like Donald Trump in that rally who are not asking the right questions. Surprise, surprise. They're not saying, now, what are we going to do to make sure that these schools are going to open safely? There are more regulations about opening a restaurant safely than opening your local school. And it should be, how are we going to distance? We can be very creative about that, and that's going to be hard. Disinfect. We're probably going to need more people cleaning the buildings. We're going to need washing stations. We're going to need to buy a bunch of disinfectants. We're going to need the PPE, the personal protective gear, the masks, the gloves. And we're going to need to have constant health checks, maybe throughout the day. I had 39 sixth graders in my classroom one year. That was not healthy without a pandemic. So what are we going to do? Are we going to do split sessions? Are we going to have creative use of space? Are we going to have class outside? And is it going to look very differently if you're in a small rural school than if you're in an overcrowded urban school? Yeah. And why aren't these politicians saying, all right, here's the plan of how we could do it safely, and here's the extra resources, the extra staff, the extra cleaning disinfectant and PPE. Here's all the extra things you're going to need to do it well. No, what we're being asked is, okay, we're not going to do it well. So are you coming back to a safe school, or are you not coming back to an unsafe school? We're talking about opening unsafe schools. And
you know, let me just say, when I hear you talk about all these things that have to happen as a parent of 3 kids, I'm saying there is no way in hell that I can imagine a scenario where you have kids on a campus who are socially distancing. I just, kids have been, like you said, March happened, the fire alarm went off, teachers had to run out of classes, kids ran out. So I can't imagine little Johnny and little Mary seeing each other for the first time after 5 or 6 months of not seeing each other, and not just running up to each other, giving each other the biggest bear hug, sloppy, spit-filled kiss imaginable. So how do you say to any parent that that's not going to be the reality?
So everything is going to be very different. They actually did some studies, and this is what we desperately need. We need someone who knows what they're talking about, who's researched this, who can say, here are the risks, here's how you can do it. They did some research with little tiny kids at a YMCA in New York, where the folks working in the hospital, the frontline heroes, said, I can't go to my nursing station unless my 3-year-old has daycare. And so they had 9 kids per adult. They had no more than 10. They had ways of training those teachers and paraprofessionals in how to play games so that kids were, they were doing like, we're airplanes. They had some, and they said it was very expensive. They needed very creative spacing. They were moving into unused office space so that they could have enough. So nobody should kid anybody that this isn't complicated, that it might be, I had one teachers say, if we bring the little kids back, maybe it's easier for the high school kids to keep learning for a few more months virtually. And we use the great big high school for our little kids. So, I mean, I don't know if that's a good idea or a bad idea. My point is people are being very creative, but you can only be so creative before you have to say, if you don't give us what we need to open this school safely, we do not want to open an unsafe school.
But Lily, look at those statistics I read at the beginning of the show. 60% of parents said they are ready for these kids to go back to school. They're saying this homeschooling is too tough. They can't handle it. It's stressful. The kids are isolated. The kids are bouncing off the wall. They're regressing academically. They're developing all kinds of emotional issues. What do you say to the 60% of those parents that say, you know what, we'll take the risk, whatever risk there is in sending our kids back, because we think the risk of them staying home or the problem with them staying home is greater than any problem they may encounter, even in a school that's not perfectly sanitized, where there's not perfect social distancing and all of the other guidelines that should be in place.
I would look any parent in the eye and say, no educator, no parent should want to open an unsafe school, non-starter, and stop giving us a false choice, politicians, that either we open an unsafe school or we close school. Why isn't it an option that we do what we need to do to open schools safely? And we do not even think about opening schools at a time when it's unsafe and in a way that is unsafe. That should be like off the table.
Yeah, I want to bring in a parent now. Her name is Chania, and she has a 9-year-old, and she lives in the Atlanta, Georgia area. And we know Atlanta has been seeing this crazy spike of cases. It's one of the states now that has this huge surge. And Chania has some concerns about sending her child back to school whenever schools may reopen. So, Chania, tell us what some of your concerns are about sending your 9-year-old back to school.
Hi, thank you for having me. I'm on board with Lily. I think that, I'm sorry, I'm at work. I think that what we need to do is to make sure that we have a plan in place. Think about it. 4 months ago, this disease or this virus has changed from what we knew about it 4 months ago. It's not in the same place. We have a different demographic people that actually have it. We don't know the full course of the disease or the virus. And my concern is that without knowing that, I feel like I would be putting my son in harm's way to send him back to school at this time. We are having face-to-face meetings upcoming within the next month for school. And my husband and I have already decided that we are not on board at this time. The date still remains contingent on the department and the superintendent when school will start, but they are giving us options. Do we want virtual or do we want face-to-face in school for the children? But I at this point, and it's so early in the virus, I'm not on board with sending him back.
I've got to ask you, Chania, what would make you feel safe? Like, what would you want to see in place that would cause you to feel as a parent that it's now safe for your son to go back to school?
I would like to see the numbers go down drastically. Okay. I am not seeing the numbers go down. We had a flat curve and now it's going back up. And I suspect after this weekend, it will continue to rise. I can't foresee into the future, but until I see a drastic change in the numbers, we don't know if it will affect children at this time. It may not. What about the teachers and the janitors and the classroom or the cafeteria lady? We don't know how this virus is actually working. I know that there are a lot of asymptomatic people. I've actually had people that were tested and they're positive, but they have absolutely no symptoms. So how exposed do our children have to be before it actually starts to affect them?
We actually do know, Chania, we've gotten a lot of good reporting lately from, infectious disease doctors stating that younger people are susceptible to the virus, and that it was just some big myth that this was only an old person virus, and that younger people are spreaders to, their parents, their grandparents, and to
Yes.
particularly those families when they have intergenerational families. So for you, Lily, so Chania says she needs to see the numbers coming down substantially, which we know right now the numbers are going up, at least in 36 states. So is that a calculation for you as the head of this, huge, union of teachers and educators? Is that going to be one of the factors that you're looking at in terms of making a decision about what you're recommending to your teachers?
Absolutely. And here's what really, really makes me so angry. You showed that clip of Donald Trump. You also heard Donald Trump say he was dead serious when he said, "Oh, I think we should stop. I think we should stop testing. I think we should stop tracing. We don't want to know this stuff because it makes me look bad." And so every infectious disease expert, because we're educators. I can teach your kid how to love reading. I'm looking at the experts here, and they're saying you have to have like 14 days of a certain type of decline in the infection rate to know it's safe to go to whatever phase you're going to, whether that's opening a store or a restaurant or opening your school. So if we don't have that incredibly important information, we don't have the baseline. You've got people like Donald Trump just saying, "Open the school. We want those parents back to work." Nobody wants to sacrifice their kids to that. And so, yes, we need that plan that says, here's how we can be creative in distancing, disinfecting. We need that equipment. And thank you, parent. Thank you for reminding people that there are also big people and kind of older people in that school too. And we are at risk. And how many horror stories did we hear about nurses, about the hospital janitor, the doctors, the technicians that were not given the safety equipment that would protect their lives? Now they're saying, yeah, we can do the same thing with teachers and paraprofessionals and the school janitor and lunch lady, where we're going to ask these folks to sacrifice their lives and their families and their health because we need mom and dad to be back at work. This is a trade-off that just makes me shiver. It makes me shiver with shame that someone like the president would even suggest such a thing.
No, and I'm in total agreement with you, Lily. This is all about science. And unfortunately, we have a president that is so disdainful of science and dismissive of science. But Chania, I do think that we can't give short shrift to what we know is happening to so many kids. And even the Association of Pediatricians came out and said that they think that kids need to go back to school because of the academic regression and the social emotional issues that so many kids are experiencing, at least in a negative way. So do you have any concerns, Chania, about your son's regression or lack of progress academically, or about his social emotional growth? Because those are real issues too.
Yeah, I think in this day and age, we have the ability, number one, numerous of people homeschool their children. Okay, so this is nothing new, homeschooling children. We can find other avenues to keep up the socialization. My son himself does Roblox. Oh, did I just lose? Oh,
you just turned your camera off.
I saw that. I'm so sorry. Just touched it. Yeah.
Go ahead, just continue.
Okay. My son FaceTimes with his friends at least 3 or 4 times a day. They actually have a very, very avid relationship with several children in the neighborhood. And they do the Fortnite, they do the Roblox, they laugh. In my experience, I am not seeing any type of social disadvantage for him as far as his socializing, nor regression emotionally. I think in any event, that's up to the parents to maintain and to reassess that on a daily basis outside of school, even when school is in session, face to face. So I think on that note, it actually gives us more time to be with him. I'm able to see a lot of his personality outside of being gone for 6 to 8 hours a day. So I think we can look at this in a beneficial way and not so extreme negative. It's very important to keep the child safe as well as mental health. That needs to be intact as well, but his safety is for me, the most important physically.
Thank you, Shonda, for sharing your views about your 9-year-old son and your decision as a parent. And we definitely respect your opinion. And 60% of parents disagree with you, but 40% of parents in this recent poll agree with you that it's too soon to send kids back to school. So again, thank you for joining us this morning, Shonda. Be safe out there, and we wish you and your son the best.
All right, thank you.
Now we want to bring in some parents who really don't agree with Chandra. They are in that 60% of parents that say that their kids, that they don't think, or 60% of parents that say kids should go back to school. So I want to bring in Priscilla and Shawanda and Marcus. Shawanda and Marcus have an elementary school kid, and they also have a kid in college, and they say they're on the fence. Priscilla, though, has an elementary school child, and she says she's ready for her child to go back to school. So welcome, Priscilla. Welcome, Shawanda and Marcus. Well, I see Marcus. I don't know if we have your wife with you, but good morning to all of you. So we'll start with you, Marcus. So you have a college student and you have an elementary school student. So tell us what you're thinking about this whole school debate. Where are you on this debate?
Yeah, good morning. My wife was actually teleworking this morning, so she's got a little delayed in the meeting, so she may not join us this morning, but she's coached me up well to speak about it this morning. Yes, we have a 12-year-old and a freshman in college. She's going into her sophomore year in college. With my 12-year-old, she's going to the 7th grade here in San Antonio, Texas. And as you all know, Texas has one of the largest spikes in positive test results in the country. Specifically here in San Antonio, we had the highest positive rates yesterday of 768 individuals tested positive here in San Antonio for COVID-19. Specifically about Sydney, my 12-year-old, she does a Roblox as well with her friends as far as a social interaction online just about every day. And she actually excelled at the homeschooling that we had towards the last part of the school year here in San Antonio. But I do think Shawanda and I both have a level of concern because she also takes gymnastics. And about 2 weeks ago, we let her go back to gymnastics for the first time. 5 days after her first practice, one of the kids tested positive in the gymnastics school. So, and after we got that positive test result, it took about 4 days for the gymnast school to notify the parents. So there was about a 4-day window where there was a positive at the gymnastics school, and we didn't know anything about it. So we just can kind of imagine how it's going to be once we actually get back into the school environment. Just like you had said earlier, these kids are going to be very social, hugging, kissing, high-fiving, sharing meals, sharing drinks, the same stuff that they always do because the kids are just social by nature. So Shawanda and I are concerned specifically about, how will that look, because we also have my mom here who's about 74, 75 years old, who lives with us here in San Antonio. And that's always a level of concern whenever we go outside to have some type of exposure and bringing it back into the household, because Sydney is literally on her grandmother like every day. So that social distancing aspect in the household can be somewhat trying. And also the Texas Education Agency, they were supposed to distribute a policy or a plan as far as how the schools here in Texas were going to operate. And that plan was postponed on June 23rd. And we still haven't received any additional guidance as far as like what's going to be the scope of the precautions the schools are going to be taking here in San Antonio. So it's just it's just random right now. There's no defined guidance as far as like, what it's going to look like in these schools when the schools resume in August. And we're just concerned, for Sydney's well-being as well as my grandmother's well-being as well. And even for Haven, who's going to college at Alabama State University in Alabama, is that how's that going to look when she goes back to college? We take her there, there are roommates coming from all over the country, interaction. I know the school is actually implementing a face mask policy for the entire campus, but you just don't know what's going to be the process when one of those kids come back positive, as we've seen with a lot of the athletes that are going back to colleges right now. It's just random. You know, you might have one kid comes back positive and then it just spreads. I mean, some of the colleges have seen, 25 and 35, athletes coming back that are testing positive. And right now it's just kind of an unknown entity as far as like how we go about doing this. But at the end of the day, it's about, Sydney and Haven being able to, actively, get their education and also have that social interaction. But also we have to, make sure that we're doing it in a safely and well thought out process.
No, no doubt about that, Marcus, and you articulate that very well. Some of the concerns that parents have, not just elementary school, but college. And you're right. These colleges that have tried to have these practices, these workouts with sports teams have had huge spreads amongst those sports teams where they've had to dismantle them and rethink the whole condition. And unfortunately, we're seeing colleges say, look, we're not reducing that tuition. You're not going to pay any less, but you still are going to, come to campus, and we're going to do our best to keep kids safe. But a lot of parents are like you, and I have 2 kids who are considering grad school at this point, and I know as a parent, I'm very concerned about, allowing them to go onto a campus. But I want to talk to Priscilla, because Priscilla, you said you are ready for your child to go back to school. So tell us, what makes you feel safe about letting your child go back?
I think my circumstance is a little bit different. Are you able to hear me okay?
We hear
Okay.
you.
Yeah, my circumstance is a little bit different. Overall, I understand everybody's concerns. I unfortunately am exposed to COVID daily, and I've been exposed daily since before this even became a pandemic. So I do have an elderly mother who lives with us. She's in her 70s. And unfortunately, me and my husband were exposed, and we believe that we did have COVID again prior to a pandemic being declared, and this was before testing was available. With that being said, my child, who is 8, going into 4th grade, is exposed daily from myself returning home from work, more so than she would be from strangers at this point. Uh, Every day I check her temperature. Every day we monitor our temperatures on a weekly basis. I receive phone calls from work about, what day I'm at in regards to exposure. And then I'm started on another cycle of a 14-day exposure. So with that being said, that is why I'm okay with my child going, because of her risk of exposure is greater, is just great just because of my job. With that being said, I do have concerns about her going to school, because with what Chanya had stated earlier, we don't know at this point in time with COVID what her risks are in regards to continuing to be a long-time carrier. That is something that we are uncertain about. So even if we have precautions in place, I unfortunately don't know if she will be a risk for teachers, if she will be a risk for cafeteria workers. And so with that being said, I just have to, on my safety for my child, I feel that she's safe to go to school, but at the same time, she may not be safe in regards to school teachers and cafeteria workers. And so it puts me at a difficult situation in what is best for my child in regards to education, and then putting other people at risk. She's also 8 years old. Is she able to wear a mask? We live in Nashville, Tennessee. They are not going to announce what the school district plans on doing until next week on July 6th. Uh, there are already talks that they plan on having 2 options available: virtual school versus going to school in person. Parents will have the ability to pick either option, but if you choose to go to school, you will be required to wear a mask. I do not think she'll be able to wear a mask for 8 hours a day. And
Right.
so I spoke with her about that, and I want to be able to also give her a decision in what she chooses to do. We did virtual school. for the last semester when the pandemic was declared. She got through it. I don't think it was the best program in place with her school district. So she would prefer to go to school, but then again, I don't think that it's going to work out well for her to wear a mask. And so, with that being said, although I would like her to go to school, I don't know if she's going to be able to wear that mask all day. And then I'm also worried about her putting the older people there at risk because again,
And
we
let's talk,
just don't know.
let's talk about that. That's a good point, Priscilla, the mask point and the older people, Lily. So we know schools are full of not just students, but staff, lots of staff.
Mhm.
From 18-year-old probably, to 75-year-olds that work in schools. And we do know that even if kids don't get really sick from COVID-19, we know they get it. We know right now the science says when they get it, they don't get it sick. They don't tend to die like we see with older, people who are in nursing homes and just the older population. But we know they can spread COVID to older people. And we know a lot of African Americans, Latinos, people of color in school districts have comorbid conditions as they do throughout, the general population. So what about keeping those teachers? And if you have a kid that comes to school who rips that mask off, even assuming it's going to be required, how are we going to keep those teachers and those librarians and those other staff members in schools safe?
So I'm jumping out of my seat here because I'm listening to these loving parents and I'm listening to how you set up the 40, 60%. Here are 60% who want their kid back in school right now, and they aren't. That's not what I heard. I didn't hear either of these loving parents say, just like it was before, open those school doors, get my kid in there, right? They were very careful. I would put them over in that 40% who are saying, I want this done right. Of course we want our kids in school. I love my students. I talk to any teacher about what it's like right now to have to turn something you did in your classroom virtual. Oh my Lord, we're all going crazy. We're all going crazy. And just because you're having a really tough time being a pandemic parent doesn't mean you want your kid in an unsafe situation.
And well, let me just stop you for a minute, Lily. I agree with you that the parents on the show today are definitely expressing caution and concern, but we shouldn't dismiss that study and we shouldn't dismiss those parents who presumably were at that Trump rally saying, yeah, Trump, we want our kids to go back to school. Those parents are out there, and I do think we have to acknowledge them, even though we don't necessarily agree with them. But I think it's not a fair conversation if we don't acknowledge their concern or their thoughts about going back to school.
I'm absolutely dismissing that thing that what you just said about 60% of parents said, whatever, just send my kids back. I cannot believe loving parents say, even if it's unsafe, I want my kid back. And you put two, now three parents on here all saying the same thing. I care about my kid. And I want them in a safe situation. That's what we all want. And my point, but
Lily, I got to push back on you. I don't think any parent is saying they want to put their kids in an unsafe situation. I think the disagreement comes about in terms of what is safe. That's what the country is debating right now. That's why we see some people willing to wear masks and some people who are not willing to wear them, because there's a whole big debate going on about what keeps people safe and what is the science on this. So I don't think there's any parent out there saying, I want to put my kid in an unsafe environment, but they're saying safety is defined differently.
And what I am pushing back on is the way that it was presented was here are people that say, I don't want my kids back in school because I don't think it's safe. And here are people that said, I'm excited, I want my kids back. And I agree with you, if it's safe. And that is what we're being distracted from talking about by politicians. They're saying, should you or shouldn't you? When? What's the right date? And I want to say, where's the plan? You just had a wonderful parent on here saying, we were told we were going to have a plan, and I don't have it yet. They keep changing it. I am telling you, there are medical experts, including, by the way, because I looked it up, that one with the pediatricians saying kids should be back in school, but with this caveat, wherever and whenever they can do so safely. And so that is, we're not talking about what will it take to do that safely. And that's what a politician wants to distract us from. There are ways that we can say, when is it safe? And that's the testing and the tracing. Do we see it going down? When we get to that point where we see levels of opening up, under what circumstances, and what you can do with the kindergartner in a mask is very different than what you can do with a junior in high school and a mask. And why not be talking about what can be done? We're not talking about it on this, and we should be.
Do you have any concerns, Lily, that teachers might, just say if schools are opening in ways that they don't feel are safe? Because I think the safety issue is going to be debated. I don't think there's going to be consensus about what safe looks like. But do you have any concerns that some teachers, particularly those that may have pre-existing conditions, may be older, may actually strike or may say, we're not returning unless safe is defined in a way that they think safety should look like? Do you have any concerns about that?
It won't just be teachers and lunch ladies and school secretaries. It will be not only those 40% of parents that you said, but I believe the parents that you had on here saying, we'd like our kids to go back. If they're not convinced that it's a safe situation for their children, they are keeping them home, even though nobody wants to be a pandemic parent. No one wants to be a pandemic teacher either. We want to go back to normal, whatever normal was. I hope we can do something better than normal, because now we're seeing all of the inequities. And by the way, let me just throw this in for another bomb. We know which schools are more likely to be safe and which schools are more likely not to be safe, that have old circulation, don't have air conditioning, and have a school nurse, and have low class sizes. You go into the whiter, more affluent neighborhoods, they started at a different level of safe than some of our very poor, high minority communities, where they started off at a disadvantage. Who do you think they're going to push to open first, and not care? Not care about the adults that work in that building, and not care about the students that learn in that building. We are convinced you have to start with equity. You have to start with saying every school should have what that school needs to open safely. And we are scared to death that it will be another mark of shame on this country, that we will be forcing communities of color and communities in poverty to open before schools in more wider, more affluent areas are told they have to open.
Well, that's an excellent point, Lily, and that's a big wish list, because we know in terms of equity, I've been working in poor schools as a special ed lawyer, civil rights lawyer, and poor schools don't even have books. So when we talk about equity, we talk about, the things that are going to make kids safe in a poor school during a pandemic. We are so far from that I can't even imagine what that's going to look like when you go into urban communities. I just want to make sure we get to talk to Shawanda. I see she's joined us. Shawanda, your husband so eloquently stated what your position is as it relates to your 12-year-olds, but tell us about your college student. What concerns do you have? I get really worried when I think about what happens on a college campus, all the parties, all the drinking, all the hanging out that kids do. I can't even imagine what safety looks like for a college student. So what are your concerns about your daughter, who's, I think your husband said, a sophomore in college?
She is, yeah, she's a rising sophomore, attending Alabama State University in Montgomery. And we do have some concerns. Of course, the numbers of cases that are going up are in that range of the younger adults. And although the school has put out a plan, it's just like she just mentioned, what is safe? What do you call it? And so a lot of the concerns are, they're giving them the option, whether it's gonna be 40% in the classroom or a hybrid plan where they're gonna take some of the classes online. Well, some of the instructors or the professors don't even have that access, so they are gonna require the student to come in the classroom. They are pushing the safety measures where they have to wear the mask, clean down everything. but you have a roommate, you know, because she lives in the dorms. She'll be moving back into the dormitory. So huge concerns. I thought the plan came out fast regarding, you know, the university, since I have a sister who's also a instructor, also a teacher, where the Alabama Education Association hasn't put out any guidelines for how the schools are supposed to look when they're coming back. So I was kind of surprised to see that plan come out to the students already.
All right, we're running out of time. I just want to do a quick poll.
Yeah.
Marcus, Shawanda, kids going back to school in August, yes or no?
We're not sure. We're not sure yet. We got to. Yeah,
You started on the fence and you remain on the fence. What about
Yeah,
you, Priscilla? If you get the notice that your daughter's school is opening, yes or no? Going back?
I am still on the fence as well.
Okay. All right, we're gonna have to leave it there. But thank you so much to Marcus and Shawanda and Priscilla for joining us and having this really difficult conversation. Of course, Lily, thank you for enlightening us in terms of what educators are thinking and what you're thinking as the leader of over 3 million educators across this country. This is not an easy decision. There are so many issues, and yeah, I wish there were more conversations happening like this at the national level, at the state level, and I wish the conversations were including the word money, because for any of this to work, schools have to have more money. We can't even talk about safety if we don't talk about getting more money, particularly into those urban schools and low-performing schools and schools where kids don't even have books. So I can't even imagine we're gonna have all this extra staff cleaning in schools where we don't even have books yet. So let's keep having this conversation, keep lifting up these issues, and hopefully the folks that control those purse strings will start to listen. But again, thank you all for joining me for this really critical conversation.
Thank you.
Ooh, this is a tough one. And we've heard from parents and we've heard from a national educator. Now we're going to talk to some folks at the regional level and just see what they're thinking about how we get, 56 million kids may not go back to school after already having been out of school since March. So this is tough work. This is where educators and elected officials and policy leaders, this is where they really earn their bucks. This is where they, show us what they're made of. So our next guests are all experts in the field of education. And joining me now are Dr. Chris Nellam. He's Deputy Director of Research and Policy at the Education Trust West. Andrew Spar, he's Vice President, Florida Education Association, and Noel Candelaria, who's President of the Texas State Teachers Association. Welcome, gentlemen. You all have been listening to this tough conversation we're having, and there are no easy answers, but I wanted to bring all of you in this conversation because, one, you represent different regions of the country, and then Dr. Nellam, you represent students who are traditionally underserved in the school system, and we heard Lily raise that issue. So I'm going to start with you, Dr. Nellam. Tell us what's your biggest concern, particularly as it relates to minority students and students who are in schools that are traditionally underfunded.
Yes, for sure. Thank you so much for having us this morning. Much like Lily, many of our concerns, we spend our days and nights advocating for and with students of color, Black, Latino, low-income students. And much like Lily, our main concern is that teachers, students, and staff are safe. But we know, as you said just a second ago, that we don't give every school enough or adequate resources, we think, to keep students safe. So we need to make sure that in particular, the schools that are serving Black kids, Latino kids, and kids living in poverty get those resources. So one of the examples that we've been reflecting on is we know one of the things that we really want to see from schools is that they have a detailed plan for how they intend to do this. So some schools we may see, for example, in their plan may have sanitizer in every classroom, multiple stations in every classroom. They may have sanitizer in the hallways and in the restrooms. And then some schools can execute on that plan quite easily. We know that those schools are likely less serving fewer students of color and likely serving fewer students living in poverty. But we also know that there were schools before the pandemic that were scraping by to keep soap in their restrooms even before this pandemic. And so for us, when we think about the most important issues. There are many, but the most important issues we think are us as a society figuring out how to overcome what we know is structural inequality, the fact that some schools have fewer resources, systemic racism that we know is leading to us making poor policy decisions. And so when we think about reopening schools, we think that that is the most important issue, to keep folks safe. And again, folks have to have a plan, particularly in underfunded schools, to keep folks safe.
Well, Andrew and Noel, you all are in the hot spots. You are in those states, Texas and Florida. Boy, are you guys raging out of control. And I remember watching the governor of Florida a couple of months ago when New York was the hot spot, almost kind of bragging like, that's New York, that's those folks over there, that's not Florida. We got this under control. And look how quickly things have turned. So what considerations, Andrew, are happening, the conversations that are happening in Florida around getting kids back to school, particularly because we talk about masks. We've been talking about masks all morning, but there's no mandatory mask policy in Florida. And your governor said he's not going to do it.
That's correct. And actually, a couple of weeks ago, when the numbers were not as high, the governor issued an edict that he wants all schools to open normally and at full capacity in person in August, when of our districts go back to school. You saw parents kind of on that side, but as these numbers have increased today, the numbers that came out today for yesterday, 15% of tests came back positive, which is the highest number we've had here in the state of Florida. And so there are concerns. Over the last week and a half, we've had actually 2 17-year-olds in the state of Florida in different parts of the state pass away from COVID. So this is a issue for our schools, not just for the people who work there, but for the students and the parents as well, right? Lily was saying it earlier, safety has got to be paramount. The health and safety of our students and the people who work in our schools has got to be the driving factor. And you said earlier, money matters, and it does. And as was just being said by Christopher, it is true in a lot of our schools, especially our schools that serve the students who live in the highest poverty levels. They don't have soap all the time in their schools. They don't have the cleaning supplies. And so you're talking about needing to put huge investments into our schools. It's why the HEROES Act is so important out of Washington, D.C., which is going to give money to districts so that they can actually provide those kinds of health and safety measures. Lily was right as well. We've got to go back in a fashion that allows people to be safe, that allows our students to be safe and the people who work in our schools. When you put 60 some odd 70 kids on a school bus, 3 in a seat, how is that social distancing? How is that safe? When you pack literally hundreds, if not 1,000 kids into a small cafeteria for lunch, how is that keeping kids safe? How do you say to a kindergarten student, hey, it's recess, but don't go on the playground equipment and don't get too close to your friends? How do you do that? Kindergarten kids are all about tactile senses. One of our leaders coined this phrase, pandemic pedagogy, that we have to think differently about how we operate in a pandemic than we do in a normal situation. And I think that's the part that is often getting left out. Our governor here in Florida and many others have talked about this notion of we need schools to reopen. I think even the Vice President of the United States said this. We need schools to reopen so the economy can get back to normal. The economy cannot get back to normal when you have these spikes because we're not being smart in what we're doing. And that includes in our public schools.
So I hear what you're saying, Andrew. And no, I want to bring you into this conversation. Everyone keeps talking about this plan. We've got to have a plan. We've got to have a plan. We've got to have a plan for safety. But who is going to develop this plan? Trump says reopen the schools because kids have great immune systems. And I watched Dr. Fauci yesterday when he testified before that Senate committee. I didn't hear any plan being developed at the White House, coronavirus task force level. We haven't seen a plan that obviously that parents know about or feel good about. So who's developing the plan?
Right, and I think that's the biggest challenge that we have seen, not just here in Texas, but across the nation, is, you have a lieutenant governor here in Texas who just yesterday said that he's going to stop listening to Dr. Fauci, because he doesn't agree with them. And so, when the commissioner of education in Texas and when commissioners across the state and superintendents are not only bringing in the medical experts to have these conversations, but the educators who know how student movements happen in a classroom, in a building, in the hallway. We have to be part of that planning conversation. And, you know, here at the Texas State Teachers Association, we released our TSTA standards, you know, for students, educators, and schools to be able to begin to have a conversation about how do we reopen safely, including, you know, what does it look like to wear masks? What does cleaning look like? What does it look like to get on a bus? I mean, all these things that Andrew brought up, that the parents have brought up, that Lily has brought up, these are things that we have been talking about for over a month, yet nobody is reaching out to the educators to sit down and be part of this conversation, because we are the experts. Our bus drivers know exactly, you know, what needs to happen and what they need in their buses to ensure student safety, if it is safe at all, because we haven't even had the conversation, you know, how safe is it and how many students and what equipment needs to be on a bus and available for students, you know, to be able to even just get on the bus to get to school. If a student is going to the restroom, you know, leaving class, what does that look like? How many students are we going to be allowed to be in a classroom, and who's going to be available? Because we're going to need additional staff to be able to come in and completely sanitize between every student coming in and out of the restroom. I mean, for surfaces are touched. So for us, I mean, it's, you know, it's ludicrous that the educators are not being brought in to the conversation at all levels. You know, and some school districts are doing a much better job than others. You know, I have been hearing of some school districts here in Texas that are putting out task forces of educators and their union leaders to be able to be part of this conversation, but it's not systemic and standardized across the state or across the country. Our Commissioner of Education, even though we rolled out our plan, has yet to reach out to us as the Texas State Teachers Association to say, we want to hear your voice so that we can put together a statewide plan that can be followed, that can be systemic, so we can ensure the health and safety of all students and educators, but the community at large. And so even hearing what, you know, when you were bringing up the polling earlier, what we also forget is a lot of the people that respond to the polls and response to surveys are people that have access to connection. There are so many parents who are not connected to the internet, who are not connected, you know, to social media, who are not connected to email, to be able to respond and get their voice in the room. And so we're talking about equity. You know, our educators have been doing a tremendous job of not just, if they couldn't reach a parent or a student through digital means, they were going and visiting their homes through the glass window, and sometimes even providing instruction through that window, because that was the only way they could connect to their students. And so, you know, when we're talking about connectivity and what we're hearing from parents, we want to make sure that we're hearing from all parents and all educators, so that we're all part of the conversation to ensure student safety, educator safety, because we can't talk about one without the other, because we work hand in hand in tandem. And then going back to the resources that are needed. You know, here in Texas, the governor supplanted the last funding from the CARES Act when our school districts went through extreme expenses of connecting students, you know, investing in digital materials and Wi-Fi hotspots, and they were counting on that CARES Act. And the governor did what Texas has done before, took that money, supplanted it instead of augmenting budgets. And so, you know, we need to have these conversations. We need to reach out to our senators right now who are sitting on a bill that will provide billions of dollars in resources that our students and our districts need in order to be able to begin to fully implement and begin talking about what we need and what we have and what we don't have to open up schools safely.
So one of the things you said a lot there, Noel, and obviously what I hear as a parent, I'm going to step outside of my role as a host and as a civil rights lawyer, but just as a parent of 3 kids, I'm hearing that there's a big fight going on. And I don't know, I'm not knowing who is in charge here. Where does the buck stop? Who's ultimately in charge of this plan and making sure that this plan is financed and that it's implemented in a way that doesn't impact each district differently? Because if your kid goes to District A and there's a plan for District A, but there's not a plan for District B, that means that we're still going to see the spread of this virus, because kids are going back to school with this uncertainty and this inconsistency. So, Andrew, I ask you, where does the buck stop? Like, is it with the superintendent of every school district? Is it with the state superintendent at the state level? Is it the governor of each state? Who's responsible?
I think we first and foremost need a coordinated plan across this country. I think the president—
Who's making this plan?
So it needs to be, there needs to be parameters. And, you know, the president's doctors, who are experts, by the way, and I think Noel was hitting on it, we've become a society that ignores experts. We don't listen to doctors anymore. We don't listen to the educators. We don't even listen to the parents or
But Andrew, somebody's got to answer me. Who is responsible for this plan?
I think it is the president, I think it is the governor, and I think it is the superintendents. And they've got to have the right people at the table making these decisions. And it needs to be, it can't just be school district by school district, because you just pointed out, if there's a school district that decides to open full blown and you have another school district that's taking precautions, you're not stopping the spread if it pops up in one school district. It's the same thing state to state. So there's a responsibility at every level, and they have to listen to the experts to guide this. What are the medical professionals saying? What are the educators saying?
Well, let me ask you this, Andrew. So you said the president and the governor. So Lily said, get the politicians out of this decision. So when you say the president, or do you mean the CDC? Do you mean the infectious, disease doctors? Who do you mean when you say the president? Because Lily said she didn't want the politicians making the decision about going back to school.
Politicians have to lead. They can't be in the way. And that's what I think Lily was talking about. Politicians have to lead, which means they need to have the right people in the room and lead and get out of the way of a conversation on what needs to happen as a country, and then as a state with the governors, and as a school district with the superintendents and school boards. That to me is where it needs to happen. There are a ton of guidelines that both the National Education Association, the American Federation of Teachers, the NAACP, others have put out to talk about what parameters have to be in place to reopen schools. And that needs to filter down. And then there needs to be an honest conversation about where we are. We cannot avoid and ignore the advice of doctors. We cannot avoid the advice of our educators. And we need to have parents have a clear understanding of what the options are and how do we do this safely. There are ways to do it safely. We need to talk about social distancing. We need to make sure that we have the protective gear in place for students and for people who work in our schools. We need to be able to track situations if a case comes up. We need to stop outbreaks before they happen. It requires a lot of work. It requires a lot of time. It requires a lot of people. It requires a lot of money. We can do it if there's a will to do it. But if we keep having leaders say it's not important, ignore the doctors, ignore Fauci, ignore educators, ignore parents, that's what creates the confusion. That's why we're in a state of confusion in this country right now.
So Chris, I want to go back to you. A name that has not come up in this entire time that we're talking about education is Betsy DeVos. Isn't she in charge of the national education for the 56 million kids that go to school, K through 12 in this country? Where does she fit into this equation? Should she be convening a meeting with state superintendents of education around the country and having this discussion?
I think the Secretary of Education plays an important role. I think the Secretary could provide important leadership, also could provide guidance for school leaders and district leaders as they're thinking about their own plans. And so certainly there's a role to be played. But I think, we really are also in a position where state superintendents and district leaders themselves can also lead from their positions of power. So the California Department of Education, for example, has put out some pretty clear guidelines for what they want to see should schools reopen. I think the concern there, although it's thorough and I think very good, the concern is it's more of a checklist that local education agencies could do if they decide to do based on their local context. So again, I think issues of inequity will appear because certain districts, again, have abilities to do things that other districts don't. So I think we need clear leadership from all levels.
So we're running out of time. I'm going to do my quick poll that I did with the parents. I just want to ask each of you, what are the chances, or I'll ask you in a yes and no format, will kids be back on campus this fall in the state of Texas?
No, and they shouldn't. It's not safe based on our outbreaks, and they shouldn't be back in school in a physical.
How about you, Andrew? Will they be back to school in the state of Florida?
How would the cases rising like they are now?
And Chris, you're here in California. Will kids be back to school in California?
I don't think any of us know what's going to happen come the fall, but I'm confident in our leaders that they'll make the best choice based on the health guidance that they have. My personal prediction is no.
All right, got to leave it there. Any parents watching this, get ready. It sounds like you're going to be pandemic parents for the next, at least, 3 months, if not the entire school year of 20 and 21. Thank you all for joining me, and thanks for having this really important conversation. Obviously, we've got to keep having these conversations because parents around this country are really, really worried about what's going to happen with their kids. And as much as we do want our kids to be safe, there are serious concerns about homeschooling in terms of academic regression, as well as some of the social emotional stuff that we know is happening with kids and us parents. This homeschooling stuff is tough. So we haven't talked enough about what's going on with parents who are at home trying to juggle job, school, laundry, cooking. There's so many things that parents are going through. So we just want parents and students to know your safety is important. And these guys are all working on the front lines to make sure that our kids are kept safe in school. So again, thank you for joining me, and thanks for the great work that you're doing throughout this country. Wow, these are tough decisions that have to be made. I want to thank all of my guests for joining me today, and thanks to all of you for tuning in. If you are a parent, and if you're pulling your hair out like me and so many other parents, know that you are not alone. Know that there are super educated, super smart people that are working on these issues for you. And for our students, and hopefully they're going to come up with some solutions. I'm not so sure that I heard what the solutions are, but I am encouraged that we have some really concerned and talented people working on these issues. Make sure you're following me at Areva Martin, and you're following Special Needs Network. Big thanks to our sponsor, Special Needs Network, for allowing us to have this conversation. We represent kids who have special needs, and the issues of special needs kids, which we didn't have a chance to really talk about, are so pertinent as we think about going back to school. Thanks to my incredible production team. Just a couple of words before I get out of here. Obviously, this is not easy stuff. I keep saying that over and over again because I can't emphasize enough. And I don't envy those educators and professionals who are making this decision. I actually homeschool my two daughters. One, the experience was fantastic. She actually graduated valedictorian of her high school class. My other daughter, my middle daughter, Morgan, homeschool was a disaster. She's a social butterfly, and being at home, separated from her friends, was a really bad experience for her. So bad that we had to re-enroll her in a traditional school setting. So this homeschooling, we heard one parent say that it's easy and you can, connect your kids on Zoom. And yes, that does work for some kids, but that doesn't work for all kids. And then I have my son, Marty, special needs kid who needs so much intervention and so much support. And homeschooling has been a complete disaster for him because he doesn't have his aides. He doesn't have the support that he needs. So again, when I think about keeping him home for another school year, I cringe because I know it's going to mean regression for him. I know it's going to mean loss of so many of the skills that he has acquired over the last couple of years. And I think that's why we see those polls. And I think we shouldn't dismiss those polls. The polls are the way that they are because parents are split on this decision, on this issue, and safety is different. If you ask a parent in Florida, if you ask a parent in Texas, if you ask one in now New York or Connecticut, where the cases are actually going down or they've plateaued, I think you're going to get different answers about what it looks like to be safe. Ultimately, each family is going to have to make a decision because even if the school's open, you as a parent have to decide if you're going to send your child back to school. I can tell you in my household, my husband is like, hell no, Marty's not going back onto a campus until there's a vaccine or treatment. I don't know. I don't feel that way. I feel like I may be on the side of those parents that will take a chance and let them go back if there's certain safety precautions in place. I think what's really clear about this discussion is that we need more discussion, and we need it to happen at every level of government. We need the doctors talking about it. We need the educators. And as our last panel said, we need all of these people in the same room together because they all have so much valuable information. And we definitely need those educators and those advocates that speak up for kids with disabilities and kids who are in low-income schools and who are in poor schools, because we know those kids are going to suffer the most no matter what decision is made. So I trust that this conversation will spark other conversations that will spark other conversations, and we'll keep talking about this issue. And even though it's hard, there is a solution, even to hard problems. All right, y'all, be safe out there. And I will see you on Friday, because Friday we're going to be talking about more hard stuff, because that's what we like to do at the special report. We're going to be talking about this culture war that's going on and Donald Trump's insistence that these Confederate statues remain in place and that we continue to promote and glorify these Confederate statues. So make sure you join me on Friday at 9 a.m. for more of our conversation on race and culture. Be safe out there, and I will see you on Friday.